Hi there and welcome back. Let's review systemic lupus erythematosus SLE. We'll get into the statistics, features or signs, symptoms, what contributes or causes SLE, how do we diagnose, treatment, and the bottom line, underwriting. SLE is a chronic inflammatory connective tissue disorder with fluctuating symptoms that can affect any organ system. This is an inflammatory disease caused when the immune system attacks its own tissues. Statistically speaking, more than one-third of lupus deaths occur in individuals between the ages of 15 and 44 years. Deaths due to SLE are more than 5 times higher in women than men. More than 200,000 US cases per year. 15-year survival is about 65% and 10-year survival is about 90%. Drug-induced SLE is more common in older people. It is rare for lupus to present itself for the first time in the elderly. Disease activity typically becomes milder and sometimes dormant with increasing age. Older individuals with a history of lupus are at increased risk for vascular thrombosis, osteoporosis, fractures, severe infections, coronary artery disease, and cancer. So, what are the symptoms? This SLE can affect any organ system. So, we can categorize as constitutional, such as fatigue, fever, arthralgia, weight changes. Musculoskeletal examples are arthralgia, arthropathy, myalgia, frank arthritis, avascular necrosis. Dermatologically speaking, one may have a malar rash, photosensitivity, discoid lupus. From a renal standpoint, it could be acute or a chronic renal failure, acute nephritic disease. If we have to look at from a neuropsychiatric standpoint, the symptoms may include seizure, psychosis. Likewise, from a pulmonary standpoint, it could be pleurisy, pleural effusion, pneumonitis, pulmonary hypertension, interstitial lung disease. GI system related, one may have nausea, dyspepsia, abdominal pain. Cardiac wise, pericarditis, myocarditis are frequently seen in patients, and hematologically speaking, you may see leukopenia, lymphopenia, anemia, thrombocytopenia. Okay, enough on the signs and symptoms. Let's move on to the causes. The known causes are genetic predisposition, immunological dysregulation, and hormonal as well as environmental triggers. How do we diagnose? It is based on a combination of clinical findings and laboratory evidence. Familiarity with the diagnostic criteria helps clinicians to recognize SLE and to subclassify this complex disease based on the pattern of target organ manifestations. The presence of 4 of the 11 American College Rheumatology or ACR criteria is a sensitivity of 85% and a specificity of 95% for SLE. When the Systemic Lupus International Collaborating Clinics or SLICC group revised and validated the ACR SLE classification criteria in 2012. They classified a person as having SLE in the presence of biopsy-proven lupus nephritis with ANA or anti-dsDNA antibodies, or if 4 of the diagnostic criteria including at least 1 clinical and 1 immunological criterion have been satisfied. So the following are the ACR diagnostic criteria in SLE presented in the mnemonic called SOAP Brain MD. It's just a mnemonic. The criteria are serositis, oral ulcers, arthritis, photosensitivity, blood disorder, renal involvement, anti-nuclear antibodies, immunologic pneumomena, example dsDNA, anti-Smith SM antibodies, a neurologic disorder, LAR race, and discoid race. So that's how the mnemonic goes. The routine lab studies when SLE is suspected include CBC with differential, serum creatinine, urinalysis with microscopy, ESR or CRP level, liver function test, and auto-antibody test. The imaging studies with suspected SLE typically include joint radiography, chest radiography, and chest CT scanning, echocardiography, brain MRI, as well as cardiac MRI. The procedures that may be performed in patients with suspected SLE include arthrocentesis, lumbar puncture, and renal biopsy. I think enough on the diagnosis. You are the life underwriters, but if you are ambitious to become a doctor, then you may read a lot of literature out there on this diagnosis. To move on, how about the treatment? While there is no cure for lupus, current treatments focus on improving quality of life through controlling symptoms and minimizing flare-ups. This begins with lifestyle modifications, including sun protection and diet. Further disease management includes medications such as anti-inflammatories and steroids. Okay, so that's on the lupus SLE. How do we underwrite? As far as underwriting goes, follow your underwriting manual that your company expects you to follow, and also use your internal company specifics to modify the final rating or the offer that you would want to extend to our field partners out there in the field. Okay, let's take a break here. See you soon. Bye now.